Let's bring in Christopher Stokes from Doctors Without Borders. Mr. Stokes, why do you think this is happening? Why are these medical staff being targeted in this way?
Well, what has been shown in your film is consistent with everything we've been seeing in Bahrain for the past 2 months, basically. And the system that's been put in place has put healthcare at the centre of basically a system of oppression. And it means that both the doctors and the medical personnel are too afraid to treat the patients. And the patients are too afraid to come to the hospitals, because what wasn't shown in this report, but is clearly the other side of the story, is that it has become too dangerous for the patients to come to the hospitals, because they're also being taken away, arrested, and in some cases subjected to beatings and even torture.
And as a result, the treatment they get is now being meted out by your own people or other doctors in makeshift medical areas outside the city?
Well, it's very difficult for Doctors Without Borders on the ground to have access to people. We've been able to work with some 88 patients. We've been able to see some 88 patients, and their stories are pretty consistent in terms of the risks that they're facing today. We've been in touch with the Bahrain medical authorities to ask for either the ability to open a centre where patients will be safe and they'll be able to receive medical treatment, or to be able to have to escort patients to the hospital and ensure that they will receive medical treatment, because there have been cases even of patients being taken away even before receiving medical treatment and being arrested and then taken away for beatings.
So how are people managing to get any kind of treatment at all at the moment if they're too frightened to go to the hospitals?
Basically, they're in an impossible situation today, and our own teams are in an impossible situation, because on the one hand there's some basic medical treatment that they can receive, let's say at home, because they're too afraid to leave their homes. But in other cases, what they really need is to be able to come to the hospital. But from the beginning, the main public hospital in Bahrain has been somehow militarized.
This is Salmania Hospital.
Patients have been arrested. Salmania, exactly, Salmania Hospital. And patients are too afraid to come, and this is the hospital that was shown in your report. So basically they're in an impossible situation for those really in need of urgent medical attention. Either they stay at home and then their condition can worsen, or they come to the hospital, but they're practically sure of being arrested, taken away, and in some cases beaten.
There is another side to this, which is the type of injuries that people have received. Our investigation seems to lead us down the line that doctors believe that some unusual injuries have been caused, perhaps with tear gas, perhaps with unusual exploding pellets.
Well, what you're seeing is the result of the use of some kind of shotgun that leaves pellet marks on the bodies of the victims, of protesters, for example. And these pellet marks are very distinguishable, and it means that if you have received these injuries in a protest, then the patient is very quickly identified as being a protester, for example, and then is not able to receive treatment, or is at risk of being arrested, and in some cases, as I mentioned, beaten, and in other cases tortured even. And
just on this same tag, just one last question. In terms of the tear gas that has been used, there have been suggestions that possible nerve agents, extra irritants have been added to these. Have you heard that?
Well, we can't confirm that, but what we're telling to the Bahraini authorities is that they have to respect the Geneva Conventions, of which they are signatories. Impartial medical assistance has to be provided to people who are in need of medical treatment, and this is exactly what's not happening in Bahrain today. Patients are not receiving medical attention, medical care. We're not able to provide it, and they're too afraid to come to the hospitals. And this has been going on now for several months, and there's no sign of any improvement, even though Doctors Without Borders and other organizations and the Bahrainis themselves have been calling for the patients to be able to receive urgent medical attention.
Christopher Stokes, thank you very much indeed.